thing is probably, we're going to be sitting with a shrink on a couch and, being told what to do. So could you talk about, there are a lot of questions in the chat box. I will read each one of them separately, but there is a common thread that I can figure out from them, wherein all of them have mentioned, even though we have somebody to talk to, like in the lockdown, we don't feel like talking anymore. It doesn't seem enthusiastic anymore because it's become all of this is completely melancholic. I don't want to. But isn't that where the step one begins, Dr. Roshan, to talk?
Well, just going back to your last point, I hope that I'm the last resort, or a professional is the last resort. And the idea of doing a talk like this is to say that recognize an emotion at an early stage, do something about it, reduce its source, acknowledge it, make the routine changes and so on. And many of us already know the how to manage it, and try to resolve it before it becomes worse. I want to be the last resort, and I hope I don't have to see as many people, so that's perfectly fine, and there's nothing to be that the last resort does exist, and so on.
Right. So could we just, you were discussing with me earlier about the stages of help, how does it start and how does it progress?
And you're quite right. One of your listeners have asked a very nice question to say that, when you talk to a family and friend, sometimes you feel that they don't want to hear it because they are themselves overwhelmed with emotions. And a lot of the times what happens with talking to a family or a friend is that you get advice and being told before being listened to. And that's the difference between therapy or counseling as compared to talking to a family and friend. That you get advice, you get told what to do before you're listened to. Whereas if you seek a professional, then they will listen first and then advise you appropriately, advise you in a timely manner. That's the difference. A family and a friend can be biased, and but a professional will not be biased. They'll be independent. They don't know you, so there's no emotive elements attached to it, and they will be objective and they give you independent advice. So that's the difference. So it can seem quite frustrating that you go to talk to somebody and they're not interested for many reasons. For many reasons, we don't want to get into emotive talks. For other people, I'm already overwhelmed and I don't want to hear another sad story, and so on. Or people might have the opinion to say that just get on with it now. Come on, you can't just be sitting around. So it can be quite different for different people. And of course, if you have that friend who will listen more than talk, and who will give you less advice and empathize more, understand your problem more, then there you solve the problem. Because there's a good saying which I remember just now. It says that a problem shared is a problem halved. The moment you talk, not just your problem is halved, but you're unburdened and you're better able to allow for little space for optimism.
Yeah. So step one is definitely to talk. And like you rightly said, talk means wherein you get to say all that you get to say, and you have a good listener at the other end. Because that's where it becomes important. So first step is definitely to talk, which means a lot of us here today who are participating in this conversation and trying to share a way of doing that. And that could be step one for a lot of us. I also see some comments. Dr. Naveen has posted, Dr. Asya, I think both of them, Asya is also, she has to work at the hospital and come back. A lot of this frustration and issues also because for healthcare workers, Dr. Roshan, because they go to the hospitals, they are on the front line, and then they come back. We've also seen a lot of news in our country, what has happened. I don't want to reopen that conversation, but I think it gets frustrating, and because you need to deal with the stress there, treating the patients, and then come back and, kind of answer to everybody else around, how we've seen people being asked to leave these societies and houses and, a lot of things. If people are looking at for help, like Naveen was mentioning, Dr. Roshan, how do they seek help? When should they seek help? When should they reach out to you?
I think this is a very, very important point, and I must also inform Dr. Asya and other colleagues to say that I think that our next talk is going to be on that, of how to, mental health care of frontline workers. And the frontline workers are doctors and nurses and, the police and other staff. And coming down to the doctors and nurses itself, they are facing much higher levels of stress and anxiety because, like the rest of the general population, they're directly exposed to people who are infected or might be infected. So they are facing a lot more stress of working in that environment where they might catch infection, they might transmit infection to the family members, they might transmit infection to other patients. So being in a caring profession, that is the principal care, that you care for other people much more than you care for yourself. uh, and in these difficult times, doctors and nurses and frontline workers are facing a very significantly higher levels of stress, uh, and they need to be looking after themselves much more. For example, they need to rest more, they need to talk more, they need to communicate more, and they need to communicate those anxieties more to the family members as well. Because if doctors and nurses are coming back home, then they need to assure their family members that they are safe, they're using good protective equipment, and that they're going to be looking after themselves. That because the family is going to be worrying about them, that are they going to be healthy and are they going to be fine and so on. They're not going to be worried to say that will they bring us infection. But so you need to assure the family member to say that I'm going to be safe, I'm going to look after myself, and I will put my safety and my care as a priority. Perhaps doctors tend to put our self priority much below, but now I think we need to put it at par, so that the family, who are our main anchors, are also assured that we are safe and we're going to look after ourselves. And I think the Indian Medical Association just yesterday announced a number wherein they're offering help for doctors and nurses, specifically with anxiety, with depression, with grief, or with just talking about their emotions. Just like we have national helpline for other things, doctors and nurses also have a helpline. I can read that out if you want. The number is 9999116375 /76. So you can add the 76 at the bottom, at the end, and then it becomes two numbers. So it's 9999116375 or 76. So try to call this number and try to get help. And what you will get is that somebody will listen to your problem, somebody will acknowledge and empathize, and perhaps guide you to things. Often we already know what to do, but they might re-emphasize to say that these are the things you need to do more of, because none of us are immune to stress.
No, we are not. Agreed.
And being in frontline, we tend to deny in ourselves and ignore that. But we are all as vulnerable as anybody else, and we need to look after ourselves. So call the helpline that's specific for doctors and nurses, and I hope that helped. You can display my email address later on, and I'll be quite happy to take specific questions from specific people.
Sure. I've put that number there on the chat box for anybody to use. Now, coming back to the point you've mentioned, Dr. Roshan, I don't think any of us are immune. And healthcare workers, a lot of my colleagues in France, friends who work in ICUs and in ERs, who are the actual frontline. Last weeks, we've been hearing horror stories both from here and from US and UK. And my friends around here who are in the ICUs and who are very, very senior and who are used to seeing really stressful conditions, now they differently in this current scenario, because of all of that, we are seeing what is happening because of the media and the news, and some of them are facts. What's happening in New York and what's happened in Italy and Spain, a lot of them were scared because we're all scared of the unknown. So they were not ready, and they did not know what is going to hit them. And we were badly prepping for PPEs and ventilators and everything. But, a lot of them, very senior and mature clinicians also have shown signs of stress, and they're still stressed out. And a lot of nurses as well, because, they're in the front line as well. So we are not immune. So thank you, Dr. Naveen and Asya, for bringing those points up. Today's conversation, like I said, is about being human, and nobody is an exemption from this. And we are all included. I'm just trying to summarize what Dr. Roshan has said about where to start help. I think one thing, once we observe the symptoms, is to try and talk to a loved one or a dear one. And another angle, Dr. Roshan, is a lot of us are now away from families also. I have some friends and colleagues who are stuck in a different town and they've got families in another town. There are people on the chat box who are mentioning that their families are in another country. Because of the lockdown, everybody got stuck. And I think it becomes all the more difficult. But first thing, I think, to seek help, if you are observing these symptoms, is to start talking with anybody who's around you, or like he rightly mentioned, somebody who would listen to you. Two, if talking to them is not helping, I think that's where you realize and understand that you need to probably seek professional help. And I think we should all do that. One is thank you so much for sharing that number, Dr. Roshan. That's for healthcare workers if you're looking for help. There is a handout that I've uploaded, which is by Ministry of Health and Family Welfare, wherein there are guidelines for mental health that's been given during the current crisis, and there is a helpline number as well. We could all look at that, but if we know we need help, and I think this is the time we need to reach out for. So that's the helpline info we've shared.